24 St. Vincent Street in Port of Spain. We are Inspirational Radio 7:30 a.m.
Tune in to the Wellness and You Show every Tuesday afternoon from 3:05 to 4 right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. I'm Karen Rudd, the host of the Wellness and You Show and a therapeutic body worker of physical therapy. To book an appointment for physical therapy or to be a guest on the show, call 868-301-4500. Join me, Karen Rudd, a therapeutic body worker for physical therapy and the host of the Wellness and You Show. That airs every Tuesday afternoon from 3:05 to 4, right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. See and hear us live in HD or high definition by visiting www.inspirationalradio730.co.tt. If you'd like to book an appointment for physical therapy or be a guest on the show in the area of health, fitness or wellness, please call Karen Rudd at 868-301-4500 or visit the website www.karenrudd.com, KARYNRUDD.com for more information. Good afternoon, Trinidad. Good afternoon, Tobago. Good afternoon, Caribbean and South America. And to those of you logged on to the World Wide Web, welcome to the Wellness and You Show. I'm Karen Rudd, the host of the Wellness and You Show that focuses on the wellness and health in body, mind, soul, and spirit. A show where various professionals in their respective areas excuse me, of health and wellness express their views and opinions, where we become informed, educated, enlightened, motivated, and inspired. A show that invites you, the general public, to call in to express your views and opinions and questions. The Wellness and You Show airs every Tuesday just after the 3 o'clock news until 4 in the afternoon. It is streamed live in HD or high definition. If you wish to see us and hear us live, you can just log on to www.inspirationalradio730.co.tt. That is www.inspirationalradio730.co.tt. The Wellness and You Show does not directly nor indirectly dispense medical advice nor prescribe treatments for sickness without medical approval. Nutritionists and other experts in the field of health and nutrition who appear on the Wellness and You Show hold widely varying views. It is not the intention of the Wellness and You Show to neither diagnose nor to prescribe. The intention is only to offer health information to help you cooperate with your doctor in your mutual quest for good health. In the event that you use this information without your doctor's approval, you are prescribing for yourself, which is your constitutional right. However, the Wellness and You Show assumes no responsibility. I am a United States trained and certified infant touch and massage instructor, deep tissue, pre- and postnatal massage therapist, reflexologist, craniosacral therapist, Reiki master, EFT or emotional freedom technique practitioner, equine or horse sports massage therapist, and an Ephraim Hunt certified professional makeup artist. The human body has an innate ability to heal itself, and its built-in mechanism called the immune system, also known as the lymphatic system. However, due to distress, trauma, or disease, physical, mental, emotional, physiological, psychological issues and others may arise or surface or take form. So I'm really excited today, as I have informed some of you, of our special guest. We've got Dr. Steve Medford with us in the studio here at Inspirational Radio 730 on the AM bandwidth. And I'll tell you why I'm so excited to speak with him today. I had the honor to be at the 23rd Symposium, the Diabetes Association of Trinidad and Tobago, 2 Saturdays ago, and Dr. Steve Medford was one of the persons who really informed us about sleep apnea. Some of you may be familiar with it, some of you may not. However, I personally am very familiar with it. So I was really excited when DAT, or the Diabetes Association of Trinidad and Tobago, had Dr. Steve Medford. I loved all the speakers actually, but I was really excited about Dr. Steve Medford because being a person who also suffers from sleep apnea, I was especially excited to hear what he had to say. So, Dr. Steve Medford, good afternoon and welcome to the Wellness and You Show.
Hi, thank you.
Thank you so much for taking time out of your very busy schedule to be here.
My pleasure.
And as I mentioned, I was really, really excited when I heard your presentation at the DAT 23rd Symposium 2 Saturdays ago. And so I would like to ask if you could educate the public, educate all of us, exactly what is sleep apnea, why it happens, and what happens when we continue to suffer with it, or persons continue to suffer with it, not knowing necessarily all of the time that we may have it, and what are some of the things that could happen as a result. And I'm just going to give you the floor. Now and again, I'll ask you questions, and at some point we will open up the phone lines, because our callers really love to call in and ask questions, and we love to encourage them to do that. So, Dr. Medford, thank you.
Okay, great. Let's talk about sleep apnea. By its very name, it's something that occurs during sleep. What is apnea? Apnea is when if you take a deep breath and you hold your breath if you're swimming or something, you'll take a deep breath and you stop breathing. That is apnea. It means it's a cessation of breathing. Sleep apnea means that during sleep we stop breathing. Now, that happens to everybody. And when I tell people stop breathing, people say, oh God, if I stop breathing, I will die. But so perhaps it's easier to say a pause in our breathing. And so sleep apnea is a pause or pauses while we're breathing. And everybody pauses while you're breathing, while you're asleep. There's a pause in your breathing while you're asleep for everyone, but it's usually less than 5 times per hour. If it's more than 5 times per hour, then we consider it significant. And we look at it in terms of, does it occur 5 times, more than 15 times, or more than 30 times? If it's more than 30 times, it's severe. The question you have to ask though is, well, why is it that stopping breathing for a short period of time is such a big thing? I mean, we stop breathing when we die, when we're eating, there's a little pause in your breathing. So why is this such a big thing? During the night when you're asleep, your body has to draw, as it does when you're awake, it has to draw air into your lungs. And it does that by changing the movements of your diaphragm and your rib cage, and creates a vacuum. And the vacuum sucks the air through your nose, through your throat, into your windpipe, and down into your lungs. There are many areas that are protected. If you put a hand on your windpipe, you realize it has a little cartilaginous cage. If you put your hand on your neck, there is your voice box. And on your nose, you've got your nose and your face as a cage, so the air or that area cannot collapse. But if you put your hand just under your jaw, that's the area that has nothing to give it support. It's only muscles. And during the day when you're awake, the brain sends a number of impulses to that muscle to keep it taut. So breathing is easy. The muscle does not collapse. But during the night, when you're asleep, the brain has lots of things to do. So it takes attention away from those muscles. It sends less impulses to the muscles, and the muscles relax. So when you create a vacuum, when you suck on it, that area collapses. If it collapses a little bit, it means less air will come in. If it collapses sufficiently so that it blocks the airway, for a while you will stop breathing. When you stop breathing under those circumstances, it's not as when you voluntarily stop breathing when you're awake. This is a different situation, and the body recognizes it as being an abnormal situation. What the body then does is the brain wakes up. The brain picks up on the signals that are coming. It picks up on the fact that your oxygen levels will fall, and it picks up on the fact that something called your carbon dioxide levels will rise. That wakes the brain up, or it alerts the brain, look, something is happening. The brain realizes what is happening, sends impulses to the muscles. The muscles open up, and you're able to breathe. And that seems very simple. It's nothing much at all. The problem arises because every time you have an arousal like that, your brain secretes or causes the secretion of a whole host of chemicals that cause damage. And that is where the problem with sleep apnea is. Now, we can think of one aspect of sleep apnea in that if the brain has to wake up all night you are not going to have a restful sleep. Now, you don't know that you woke up. It's not that you got up out of bed. No, that doesn't happen. Your brain wakes up. But that is sufficient to prevent you from having a restful sleep. And it varies during the night. In some phases of sleep, you probably sleep throughout the time without any of the brain arousing. And sometimes during other parts of your sleep, particularly a type of sleep called REM sleep, where all the muscles are very relaxed and the brain is very active. During that particular period, you have sometimes the most amount of stoppage of breathing, pauses in your breathing, and arousals.
Why is that?
In REM sleep is a particular type of sleep.
Rapid eye movement.
It's called a rapid eye movement sleep. And it's almost on a brain awake.
In other words, the rapid eye movement, when we see someone sleeping and their eyelids are
Yes.
their eyelids are fluttering, or you can see the eyeballs moving from side to side, that's when the person's actually dreaming, correct?
That's REM sleep is when you dream. And it's a very active brain time. The brain is very active in that time. But everything is relaxed. It takes all the effort away from your muscles and is channeled secretly into what's happening inside the brain. And that's why you've got all your dream sequences at that time, you've got the rapid eye movements, but your muscles are very, very relaxed.
Well, Dr. Medford, I'm stunned because you started off by saying that on average, as human beings, we stop breathing a minimum of 5 times in an hour.
Yes.
When I did a sleep study back in Maryland, in Bethesda, Maryland, some years ago in the US, I did the sleep study, and they hooked up all of these electrodes to my different parts of my
Yes.
head and my body. Like, how am I supposed to sleep comfortably with all these wires attached, And sleep I did. I slept. However, they told me that I stopped breathing at least 3 times within the hour. And that if it got worse than that, then they would have to take different steps. However,
Yes.
they just suggested that I sleep on my side. So if I dare fall asleep on my back, of course I wake up gasping for air. Some people don't wake up that way.
No.
They may snore or may
Yes.
stop breathing, and it's their partner who will indicate to them whether or not they've stopped breathing. But I would wake up literally gasping for air. So I would wake up out of my sleep, literally. But if I sleep on my side, then the air passage stays clear.
Stays clear.
So my question to you is this. If we stop breathing a minimum of 5 times per hour, isn't the brain being robbed of vital oxygen? Isn't the heart being deprived of oxygen as well?
For the 5 times power, no. It's a small thing. I mean, it's 5 times power, and they're short periods. They may be very brief, right? Seconds. It's really when it's a lot more than that, or when the pauses are really long. That's when we get a significant drop. Now, we monitor throughout the night your oxygenation. And in people who have no sleep apnea, even though they will have 1 or 2 pauses, their oxygenation remains very high. So your normal oxygenation, as we measured by something called a pulse oximeter. Sometimes when you go in hospital, you see something on someone's finger and with a little red light on it. That's a pulse oximeter. That measures the oxygenation. And we use a value of 100 as normal. So 99, 98, 100 is within normal limits. And most people who do not have sleep apnea, they will remain at that. Throughout the night, you'll see those values. But the people with sleep apnea, you'll see the levels dropping. And those who have really severe sleep apnea, the levels drop quite significantly.
So, Dr. Medford, if a person doesn't have a partner to indicate to him or to her that they've literally stopped breathing, then what are some of the signs or symptoms that a person may look for that would indicate to them that perhaps there's sleep apnea involved?
The first one we always look at is snores. Yes, you don't have a partner in your bedroom, but you're out and about with your friends, and they're the ones that make jokes about you and said, boy, you snored so loud we couldn't sleep next to you. We had to go elsewhere. That's the kind of thing. Loud snoring, that's the first sign.
What happens when a person snores?
Okay. Snoring is like, if you have a mad bull, right? You know the little pieces of paper that flutter? Well, what happens is because the air passes and it flutters. Now, the same thing happens in your throat. As you're breathing in and out, your tongue will fall back a little bit, and the soft tissues, that's the pillars around your tonsils, the soft palate. When you look at Dennis the Menace in the old days, you'll see a W, right? That part of the thing that you look at, that is what vibrates, and that is what creates the sound. So the whole throat vibrates, and that makes the noise.
So if a person goes into the mirror and opens the mouth, and
Yes.
look into the back of the throat, they can see the little.
They see the W. No, that's
The
a great
W.
thing that you mentioned that. If you open your mouth and you're looking and you cannot see the W, all you see is just a white featureless, your soft palate or hard palate, you are likely to get sleep apnea because you see, that's the person when they lie on their back, as you do, and your muscles relax, the tongue will fall back and block the airway. But if you lie on your side, the tongue will fall to the side and you'll be able to breathe.
So you're saying normally if a person looks into the mirror and they don't see that W, then that's an indicator that
That's
they
an
may have-
indicator they may have obstructive sleep apnea.
My goodness, I never knew that, Dr. Medford. Thank
Well,
you
it's a
for
simple-
informing me.
The one thing that perhaps, before we forget, daytime sleepiness is a big factor.
People falling asleep, feeling sleepy.
People falling asleep during the day. And really, after lunch, you don't normally fall asleep. But if you find yourself falling asleep after you've had a lunch, you sit down relaxing, or if you're driving and you're falling asleep, that's really bad. But any increased sleepiness during the daytime is something worthwhile checking out. And you could go online. It's something called the Epworth Sleepiness Scale.
Can you spell that? Thank you.
WORTH, Epworth Sleepiness Scale. It's a scale that measures out of 24. So if you're under 7, you're fine. That's okay, that's normal. But once you cross that area, you're beginning to get into sleepy. And certainly somebody who is giving me like a level of 14 is quite sleepy.
Now I'm looking at a brochure here from the DAT, Diabetes Association of Trinidad and Tobago, the 23rd symposium that I picked up. I have in
Yes.
my person with me at the moment, and is stating some of the common signs and symptoms of sleep apnea. Many people are not even aware they have sleep apnea. Often a bed partner is the first to witness symptoms. Some common signs include excessive daytime sleepiness, as you mentioned, Dr.
mentioned.
Medford, loud disruptive snoring, as you mentioned,
Yes.
irregular breathing or gasping, long pauses during sleep, poor concentration and forgetfulness, depression or irritability, morning headaches, weight problems, night sweats, frequency in urination, and sexual dysfunction.
Quite a few things that affect you because of inadequate sleep.
Now, I was really surprised as well to learn that a person with sleep apnea, that this could be a precondition. One becomes predisposed to diabetes.
Diabetes.
Why is that?
That one is a very complex answer, but a simple thing. Remember, I said that when you get an arousal, you secrete a whole host of chemicals. That's one of the things that happens.
Arousal from sleep.
There's arousal from sleep. Yeah, when
Not
you
the
get
other
those.
kind of
No.
arousal.
No. The other thing is that your body produces, because of the hypoxia, a number of the superoxide.
Hypoxia, you mean no
the
air.
drop in oxygenation.
Drop in
Sorry, the drop in oxygen. We produce, we talk about antioxidants and oxidants. Well, your body produces a number of oxidants, and these produce damages. So between the drop in oxygen, the production of these active radicals, the oxidants, the chemicals that are released, what they all do, they alter our cells' response to glucose. And the result of that is that we have the insulin resistance that is classical, or that's a hallmark of type 2 diabetes.
So let me just repeat that. You said it alters the glucose.
The cell, we see the thing in type 2 diabetes is that you have enough glucose in your bloodstream, but it's not going into the cells.
Right.
The keys that unlocked aren't working to allow glucose to go into the cell. Those keys are damaged by the chemicals, by the radicals.
That's really stunning information, Dr. Medford. We're going to take a break and come back and continue to speak with Dr. Medford, who is here to enlighten us about sleep apnea and diabetes, how they relate to each other, and just really informing us and enlightening us about sleep apnea that many of us may not be necessarily aware that we have it. And we'll be right back with that information. Join me, Karen Rudd, a therapeutic bodyworker for physical therapy and the host of the Wellness in You show that airs every Tuesday afternoon from 3:05 to 4, right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. See and hear us live in HD or high definition by visiting www.inspirationalradio730.co.tt. If you'd like to book an appointment for physical therapy or be a guest on the show in the area of health, fitness or wellness, please call Karen Rudd at 868-301-4500 or visit the website www.karenrudd.com, KARYNRUDD.com for more information. Yeah, let's
Just
talk
that-
about that.
What? Yeah.
Okay, we're right back. Welcome back to the Wellness in You show. I'm Karen Rudd, the host of the Wellness in You show, and my guest today, this afternoon, is Dr. Steve Medford, and he's here speaking with us about sleep apnea and diabetes and informing us about what we can look for, what are some of the things we experience that would be a sign or sign rather to tell us that we more than likely have sleep apnea. So on the break just now, Dr. Medford, you just mentioned 4 things to me that people may have that may be an indicator that they or we or I have sleep apnea.
Sleep apnea.
So if you can share with us.
The 4 things are that you snore loudly. You snore so loudly that people in the room next door can hear you. That's what consider loud snoring. The other one we spoke about is feeling sleepy during the day. So that you're sleepy, you feel sleepy, you fall asleep at work, that sort of thing. Daytime sleepiness. The third one you mentioned, gasping for breath. That's where, and it's usually somebody will notice, that you stop breathing during the night. And the normal things the wise will say to me is that I have to shake him to wake him up because I'm scared that he will stop breathing. So if you observe that, that's a really important one. And finally, hypertension, because sleep apnea causes hypertension. If you have 2 out of those 4, that is snoring, sleepiness, stopping breathing, and hypertension, 2 out of those 4, you have a 60% chance of having obstructive sleep apnea.
My goodness, Dr. Medford, I'm guilty of all 4. That's frightening. That's really frightening. As I need to find out at this point in time, where can people go to get tested? Where are the sleep centers located throughout Trinidad and Tobago, if you may know, or if you may know of a website where we can go and access the information?
Their website, there are a few people who do sleep testing, quite a few.
I think West Shore does it.
West
now,
Shore
does
has
not?
it, yes.
Okay.
Sinclair. There is Island Diagnostics, they're involved.
Island
Diagnostics
is located where?
I'm not sure where. I think their host center might be at Sinclair.
Sinclair as
I'm
well?
not sure. Yes. In San Fernando, you've got at Victoria Nursing Home, and then at Gulfview Medical, you've got TT Sleep.
TT Sleep.
Yes. There's another doctor also, who is in Medical Associates. So quite a few of the centers have affiliated with sleep labs.
When I returned to Trinidad approximately 11 years ago, I don't think there were any sleep centers at the time, were there?
At that time, there was one. There was one in Victoria Nursing Home in San Fernando, but not as well publicized as some others now.
Because actually one of my clients in private practice over the years, she eventually had to get tested and she got the CPAP. Can you tell us a little bit about that?
During the night, when you take in a breath of air, remember I said to you that area collapses. It collapses because the vacuum is so strong in that area. So what the CPAP does, and the CPAP is really an upside down vacuum cleaner. It just simply pushes air at you. Because it pushes air at you, it creates a stent. It keeps the airway open. So when you take a breath, even though you're creating a vacuum and air is rushing into your lungs, the airway stays open. When you breathe out, it's a little bit harder to breathe out because you breathe out against that pressure of air that's coming in. But there are a number of ways that they've found to overcome this. Something called a BiPAP machine, or something called expiratory pressure relief. So the pressure falls when you're breathing out, so it's a little bit more comfortable to breathe out. But the CPAP works by stenting the airway open.
Okay. And approximately, what is the cost of a sleep study in Trinidad?
It depends on where you get your sleep studies. Home sleep studies are around $2,000.
When you say a home sleep study,
Home sleep study is the one that's done at home. It's
So
a
somebody-
limited study.
Somebody
Yes.
comes to your house?
There's some people who organize so that somebody comes to your house, or another, you go to the lab, take the equipment, and take it home with you.
Okay.
Right.
Okay, and then I guess they would explain how to set up everything.
How to set it up. It's usually quite simple because the home sleep studies have few channels. You don't record a lot of information. You record enough to make the diagnosis, but it's not a lot. Whereas the lab sleep studies, as a study you had quite a lot of electrodes.
Yeah,
Yes.
a lot. And so 2,000 is for the one that you can take home, and when you go to sleep center,
It depends on where you are. I mean, the 2,000 to 4,000 for the home studies, 2 to 5,000 actually for the home studies,
okay,
and the lab studies are 4 to 6,000. Again, depending on where you do it and who you do it with.
okay. And on average, the person goes in for a few hours. Is it like 3-4 hours?
Well, no, remember, you need to have a minimum of 6 hours of sleep for the
Okay.
study to be valid.
So it's usually done overnight then?
It's an overnight study.
Right.
And that's why it's sometimes called overnight polysomnography. Poly meaning number of studies, and somnography in your sleep.
So then, what are you looking for when a person does a sleep study and goes in and does a 6-hour thing? Let's say somebody goes to a sleep center rather than having it done at home. What is it that's being looked at in particular? What would alert you? What would be the red flag that says, oh, okay, we have a serious case here?
What we look at again is the number of times you stop breathing during the night. And if overall you stop breathing more than 5 times, it is, mild. If it's more than 30 times, it's severe.
More than 5 times within the hour?
5 times per hour.
Okay.
Right.
So 5 times, no concern.
0 to 5 times, no concern.
Okay.
Right? 6 to 14 is mild. 15 to 29 would be moderate. And 30 and over is considered severe.
Okay. So someone falls into the 6 to 14 or 15 to 29 or
That is, yes.
30 or over. Someone who falls into the mild range, what are your suggestions to that person?
There are a number of options for treatment, and a few options are coming up. One of them is, the first one we tell patients is lose weight. So somebody who is mild sleep apnea, my first thing to them is tell them lose weight.
Well, if
Get the weight out.
sleep
If that's
apnea
not-
brings on
Well,
overweight, though.
it does. It distorts how your appetite is controlled. So you then have the appetite not to eat healthy, even though it's in front of you and you know it's better to eat something healthy. The drive is to eat what is not healthy because you're not satisfied otherwise. So you'll end up having to eat a high calorie, high fat subject. For example, if you had a choice between a Mars bar and an apple, you'd go and have the chocolate. You would not have the apple.
Dr.
Right.
Medford, that information is really blowing my mind because I want to know how not breathing or stopping breathing a number of times during the course of the night, why that would affect one's appetite.
There are a number of factors along the way, but remember I said that whenever you have these brief arousals when you're asleep and you release a lot of chemicals, a whole slew of chemicals, among the lot of them are one chemical called ghrelin. You produce more of ghrelin,
How's that spelled?
Ghrelin,
Okay.
and that is the one that makes you directs you to eat rubbish.
Wow. And that happens when we have sleep
And that
apnea.
happens when you have sleep apnea.
My goodness, it's really frightening. All right, so what we're going to do, Dr. Medford, because I did promise everybody that
Yes.
I'm opening up the phone lines, we're going to take a break, and when we come right back, we're going to open up the lines. Stay tuned. Join me, Karen Rudd, a therapeutic bodyworker for physical therapy and the host of the Wellness in You show that airs every Tuesday afternoon from 3:05 to 4, right here on Inspirational Radio 730 on the AM bandwidth, Radio Trinidad. See and hear us live in HD or high definition by visiting www.inspirationalradio730.co.tt. If you'd like to book an appointment for physical therapy or be a guest on the show in the area of health, fitness or wellness, please call Karen Rudd at 868-301-4500 or visit the website to www.karenrudd.com, KARYNRUDD.com for more information. We're back on the Wellness in You show. I'm Karen Rudd. Good afternoon to everyone who's tuned in now. We are in the presence of Dr. Steve Medford, who is speaking with us today about sleep apnea and diabetes. And Dr. Medford just mentioned something. As a matter of fact, we're going to go ahead and open up the phone line. So we will encourage you to call 623-7301. And we have a call. Caller, good afternoon. Welcome.
Good afternoon, Karen.
Good afternoon.
Good afternoon, Dr. Medford.
Afternoon.
Two little questions, Doctor.
Yes.
The first one is, why is night sleep better than day sleep? And the other question is, the intermittent pauses while breathing during night sleep, does it occur as well during day sleep? Thank you very much.
Thank you.
Okay, the first question, why is night sleep more valuable or supposedly more valuable than day sleep? That's a really complex question. The answer is sleep, and whenever you get sleep, it's good. That's straight off. That's the first thing.
Regardless of whether it's day or night.
Whether it's day or night.
Whether the sun is up or down.
That's it. But in us is we are accustomed, and our body is accustomed to sleeping during the night. And our whole rhythm is based on sleeping during the night. And we find that the whole host of chemicals that are supposed to be secreted, the whole way our body functions works better when we sleep at night. Do we understand it fully? No, we don't. But yes, night sleep is in a way better than daytime sleep, but we do not understand it fully yet.
And that is why, and Dr. Medford, we have another call. Good afternoon.
Sorry, there's another question she asked.
Hold on, if you can hold it 1 second, please, caller.
Yes. During the daytime, you need, if you have sleep apnea, you need to wear your CPAP machine, because you will still get the obstructive sleep apnea during the daytime as well as in the night.
Okay, thank you.
That's the process.
Good afternoon, caller.
Yeah, Karen, good evening.
Good afternoon.
Dr. Medford.
Doctor? Yes, Dr. Medford.
I know. Is as you age, do you need all these amounts of sleep, 8 hours sleep?
That question has been asked a lot, and the answer is that yes. As far as we're aware, you are supposed to sleep the same amount throughout your life. What happens, however, is that as we age, we often retire. And when you retire, you're not as sleepy as when you're working full-time. The other thing is that you tend to take naps during the day, short naps, a little nap after lunch, a nap some other time in the afternoon. And as a result of that, you're not as sleepy during the night. But as far as we are aware, and I have to say this about sleep and the research into sleep, is that it is still quite a young field. And we are learning more with time. I mean, 5 years ago, I couldn't tell you that sleep apnea causes diabetes. Now I can say that. And similarly, we do not yet understand fully how much sleep you need. The present teaching, and we will stick with that, is that yes, everybody needs to sleep 6 to 8 hours a night.
Okay, doctor, thank you very much.
Caller, thank you. All right, we're on the Wellness and You show with Dr. Steve Medford, and he's telling us about diabetes, sleep apnea and diabetes, and we have another call. Good afternoon, caller.
Well, I sleep like a baby. I don't even know.
Congratulations.
But
He
one
sleeps like a
problem,
baby,
what
Dr.
you
Medford.
tell me, and you slow the air. You're asleep. You're conscious of your surroundings. Someone would call you. He didn't call in, but just cannot wake. They actually to touch you, shake you for you to get up.
That is a condition belongs to a group of sleep disorders called parasomnias. What you need to do is you need to go in and sit and spend some time with a sleep specialist and get an idea exactly what you've got. The one thing that we've got to make sure is that you do not have something called narcolepsy. But beyond that, I don't think you do. I think it's something simple, but it belongs to that group called parasomnias, and you need to see a sleep specialist.
You know, Dr. Medford, I didn't hear his question clearly. What was it that he asked?
His question is, he sleeps like a baby.
Okay.
However, sometimes he is asleep, he cannot rouse, somebody is shaking him, he's aware they're shaking him, but he cannot rouse.
My goodness. And that's called what?
It belongs to a group of sleep disorders called parasomnias. You know, sometimes you've heard about sleepwalking and sleep eating.
Yes.
It belongs to that similar category. But you've got to make sure we're not dealing with something that's called narcolepsy, which is quite a different disorder. and that one will need investigation.
Okay, we have another call. Good afternoon, caller. You're on
Good
the air.
afternoon, Karen.
Good afternoon.
Afternoon.
Dr. Medford. Yes.
Yes.
I wonder if this is Dr. Medford who has his office in Shawona.
No, that honor goes to my uncle.
Okay. Is he still alive?
Yes, he is.
Yeah, well, that was my doctor.
Yes.
Anyway, a Medford is a Medford. Yes, this is really an interesting topic, but is it only about sleep you're all speaking about?
Yes, we're talking about people who stop breathing during sleep.
Who stop what?
Who stop breathing during sleep.
Okay, it's like, okay, yes, I know that. Sometimes you think and then you're going out.
Yes, perfect. That's
Yes,
it.
well, that has happened to me. Not very often. Not very often, but that happened to me. But what I'm saying, in the night, I hardly hear what? I will go to bed very early. Like all 9 o'clock, I'm sleeping already. Sometimes I wake up 12. And sometimes I don't sleep again until in the morning.
Unfortunately, that happens. And one of our callers earlier asked about whether as you get older, you're supposed to sleep less. And as I was explaining to him, you find because you're not as physically active that we do not sleep as much during the night. But that is really an area that we can't answer clearly and properly. And so what I will go is with the stock answer now, and I will say to you that everybody's supposed to sleep 8 hours. If this is happening to you, what I would say to you is, look, get up out of bed, go and do something. Because if you stay in bed trying to sleep, you sometimes make the bed your enemy.
Okay.
You know, so get up and do something.
Get well, I can't get up and do anything because I'm a blind person.
Oh my.
So all I
Okay,
can
sorry.
get up and do is pray. And
Okay.
that's what I do.
Fair enough.
Okay,
That's good.
so how much hours sleep at least somebody should get per night?
We're saying 6 to 8 hours of sleep.
6 to 8.
Yes.
All right, well, sometimes when I check it, it's just 4, but not 4 straight.
Well, we take what we can get, and once you're okay during the day and you're not very sleepy, we accept that and we're happy with that.
Okay. Okay, thanks very much. And Karen, you has been a bless.
Thank you.
All right,
Thank you for calling. The number to call is 623-7301, 623-7301. We are in the presence of Dr. Steve Medford, who is here talking to us today about diabetes and sleep apnea. Good afternoon.
Hello,
caller.
good
You're on-
afternoon,
Yes,
Karen.
Good afternoon. You're on the air.
Good afternoon to the doctor.
Good
Dr.
afternoon.
Medford, yes.
What I want to ask, all right, we should get at least 6 to 8 hours. If we don't get the 6 to 8 hours consecutively, like in a straight line then, and we get it in parts, like you sleep for 5 hours and you wake up, well, I just do what you say there, get up and find something to do, and then you'll get sleepy again and you'll go back and sleep and you will get the other 3. Is it as valuable as the straight 8 hours?
Yes, it is. It is, and that's the way to do it, and that is perfect.
Thank you.
Thank you for your call. The number is 623-7301, 623-7301. We're here with Dr. Steve Medford, who is talking to us today about sleep apnea and diabetes here on the Wellness and You show. We'll just take a couple of more calls, and we have a caller. Good afternoon, caller.
Hello. You're
Hello.
talking more about diabetes on this program, on this afternoon?
No, I am not really a diabetes physician. I know about diabetes and its effect with sleep apnea, and that's the angle that I come from. To talk about diabetes, you really need to speak with a specialist diabetologist.
Yeah, we had Dr. Who was his name?
Claude.
Dr. Neil Singh. We
Neil
had.
Singh. Oh,
Yes,
he's
and
brilliant.
He did a great job.
Yes.
Yes, we have another call. Good afternoon, caller. You're on the line.
Hi, good afternoon.
Good afternoon.
Dr.
Medford.
Dr.
Medford
Medford.
Karen.
Yes, good afternoon.
Yes.
I have one problem that has bothered me for years now. I snore too much.
Okay.
And anywhere I go, people complain. I'm snoring too loud, I'm snoring too much. I don't know what to do.
Okay. Here's the thing. If it is snoring only, then it is, as you said, an annoyance to your friends. The thing, Tim, is it snoring with you gasping for breath? Are you feeling sleepy during the day?
No, I don't gasp.
Okay, so the first thing you need to do is to really get a sleep study to prove that all you've got is snoring. And if it is simply snoring, then a surgical procedure may help you, as well as something known as a mandibular device. Mandibular means your jaw.
Okay.
So it's something you wear in your mouth that keeps the tongue forward so it doesn't fall back.
Okay.
And if the tongue doesn't fall back, it doesn't block the airway, and you don't get that vibration. The air passes very easily, and therefore that stops you snoring.
Another thing is that most nights, some nights when say I get up a lot to pass urine.
Right. Now, there could be other factors. If you do have sleep apnea, that is another factor that causes you to pass extra urine. My first thing really would be for you to see your doctor, who can refer you to somebody who deals with sleep, who can examine you and advise you as to whether you got or whether you're likely to have sleep apnea. The easiest people to see for sleep apnea are your ENT surgeons. And you've got a number of ENT surgeons in Port of Spain. Where do you live?
I live in Sawa.
In Sawa. So in the Sawa area, Dr. Juman is in that area.
Which area is that?
He's on the east-west corridor. Dr. Sulaiman Juman is there.
Juman?
Yes.
Okay, where is the office situated?
Oh gosh, girl, I'm not sure. It's some fancy building.
I had to look at the book to get a number.
Yes, yes.
Okay, Juman, I remember that.
Yes.
Well, thank you, doctor.
Thank you for your call.
Take care.
Okay, we can take one more call, 623-7301. We've got Dr. Steve Medford in the studio with us today on the Wellness and You show, in actually informing us about sleep apnea and diabetes. And it's quite an interesting information. We've got another call. Good afternoon, caller. You're on the air.
Yes, good afternoon. It's a very interesting program with regard to sleep apnea, and I will take the doctor's advice in getting a relative to see the doctor.
Great.
Just a quick thing. Dr. Juman's office is on the eastern main road, St. Augustine, near the old UE entrance, the old railway UE entrance. So if anybody want to get in there, that's the way to go. That building next to the old UE entrance, eastern main road, St. Augustine. Dr. Medford, thanks for the information and thanks for the program, and God bless you, man. Take care.
Thank you. Thank you for sharing the information. Well, that's it for our calls. We're not taking any more calls at this time because Dr. Medford is only here with us until 4 this afternoon. We've got approximately 14 or 13 minutes left of the program. And I have some more information that I'd like to get from him. So, unfortunately, those of you who weren't able to get through, I apologize, but that's how the program goes. You know, time is always of the essence. So, Dr. Medford, I would like to ask you, why did you get into this specific area of medicine?
In the beginning, a lot of the patients were treated by us in ENT. We did the surgical. I'm an ENT surgeon. Yes.
Oh, okay.
We treated the patients. We did surgery on the airway. Remember, we said that the area of collapse is the area of your tonsils and your soft palate. So we did surgery in that area. And that is why it came into our control. The other people who treated or who had an interest in sleep apnea would be the pulmonologist, because that's the airway, the psychiatrist, because of depression. It's interesting how all these other specialties get into it, yes. But the big ones were really the pulmonologist, the ENTs, the psychiatrists, and the neurologists. Forgot those are four. But because with surgery, that was our area. Surgery we found didn't work, and really it's because we were using surgery for everyone. And you know, I mean, not one cap doesn't fit every head, and therefore
it's not a one size fits all.
That's it. So one surgical procedure just wasn't working for everybody. There are people. Surgery in sleep apnea works if you have huge tonsils, right? If you've got a big tongue blocking, then yes, taking out your tonsils helps a bit. But even if you have big tonsils and you have a big tongue blocking it, really the big tongue is the deciding factor.
Well, Dr. Medford, I had a tonsillectomy when I was 10.
Yes.
So
yours is a big tongue.
And I still have sleep apnea.
Yes, it's the tongue falling back. And so that's why we got into it. And I got into it in the whole thing. I started doing the sleep studies. And we were the first people in Trinidad to set up a full level 1 lab. I did training abroad in Houston at Baylor College. My wife did training there. She did the full the RPSG.
She's ENT as well?
No, she's a sleep technician. Okay. It's a qualification, the RPSGT.
Which one is your lab, Dr. Medford?
My lab is TT Sleep.
TT Sleep?
Yeah, we're in
and
South.
That's
at Gulfview Medical.
Okay, Gulfview.
Yes.
Fantastic, thank you.
Yeah.
So, how long has it been now? Because you mentioned earlier
we've been
that this is a relatively new area
new. Yes.
of medicine.
We've had our lab. I think we've had our lab now. Yes, for about 6 or 7 years.
Okay.
Yes.
But it wasn't the first lab.
No, the first lab was at Victoria Nursing Home. They were the first lab, and this subsequent labs. We were the first level 1 lab.
Yeah. And so, how many people do you feel now in Trinidad and Tobago is aware of sleep apnea? Do you feel that there's great awareness, or we need to really?
I think we need to push the awareness, and in so many things. I mean, somebody who has cancer and might suspect they have cancer, and ignore it, because it's, well, oh gosh, I don't want to know and I have it. And unfortunately, with sleep apnea, it annoys. Snoring is what annoys the spouse, right? And male and females have sleep apnea. The snoring annoys the spouse, but beyond that, and we feel sleepy, we've kind of adapted to it. And we're not aware of the fact that having sleep apnea means that we're 5 times more likely to die than the person who does not have sleep apnea.
Okay, Dr. Medford, we have to do a rewind on that. Because we're all going to die at some
We're
point.
all going to die. But if you have sleep apnea,
higher risk
you're
then?
much higher risk. You
Gotcha.
you can get in a car accident and run off the road, right? Because you're sleepy during the day. Right? I mean, the thing that we all get upset about at this time of the year are kids who just finished their exams, university or the A-levels or O-levels, and they go out, Lyman partying, and they get in a car accident. And they get in a car accident because they're sleepy. So that diminishes your responses. And of course, the alcohol. So between the two of them, it is so easy for you to run off the road or get in an accident for one reason or another.
Go ahead.
And so that's the big one. But the other ones are diabetes, hypertension, cardiac disease, stroke. All of these you have much higher risk of developing. Let me tell you about a stroke. What happens when you get a stroke? Well, you could get a stroke because of a bleed, because of rising pressure. Well, during the night, because of all the chemicals that are released when you get this arousal and awakening, you release the drugs called catecholamines, among the others, and that causes an increase in your heart rate. So your heart is pumping away. You're scared. It's that sort of response. That's when you can get a bleed.
It's almost like a fight or flight.
That's what it is, a fight. It's a real fight. Think about the other side of the coin. You can get a stroke because of a clot. Now, those chemicals that are released, they increase the ability of your blood to clot. They cause, if you've got a plaque, they increase the likelihood the plaque will rupture. Remember what happens when you get a heart attack or a stroke. A plaque ruptures, you get a platelet plug, and that blocks further down. Those things are more likely to happen when you've got an awakening from sleep apnea.
Well, Dr. Medford, I had no idea that sleep apnea is as dangerous as it is. So in other words, what we're really impressing upon everybody, that if you snore, please get yourself tested.
That's it.
Get yourself tested, because you, I, all of us could be at risk for any of these things that you mentioned, Dr. Medford.
That's right.
That's frightening. Dr. Medford, are you by any chance aware, have any statistics been run regarding how many people who are in vehicular accidents in Trinidad and Tobago who actually fall asleep at the wheel?
No, we don't know that for Trinidad, but those figures are available in the States. Truckers now have to all have sleep studies done.
Where, here in Trinidad?
In the States.
In the US.
20% of motor vehicle accidents are due to sleep apnea.
In the US,
in the
studies.
US, 20%. That's 1/5 of motor vehicle accidents. And there's no reason why we are not similar.
I I know, especially the amount of vehicular accidents that happen in this country, and we just assume that is because of something else,
Yes.
rather than sleep apnea, not knowing that is the tiredness
That you're tired.
ensuing.
Yes.
Because when I lived in the States, a number of accidents that happen because of sleep apnea. I'll just share a little story with you and with the audience. There was a time that I worked a lot of hours, and on the drive home one morning at 7 o'clock in the morning, I was at the wheel at the traffic light and was unaware that the light had changed because I fell asleep at the wheel. And then when I took off and I drove off, I literally fell asleep and woke up in time to catch myself from driving into the drain where I could have died.
Yes.
So it means that a lot of us in Trinidad are probably sufferers of sleep apnea, not aware of it.
Well, it's a mix of things. I mean, there's the sleep apnea there, but there's also the fact that if you work really long hours, in the morning you can fall asleep. And that's why the guidelines, again, for work guidelines, mean that people can only work a certain amount of hours. And if they do work long hours, the employers are supposed to ensure that they get home rather than they drive home.
Well, I had that.
Yeah.
That leads me to the next question, Dr. Medford. If a person realizes that they haven't had enough sleep, or whilst they're driving, they become aware that the car is drifting, because I have driven in a vehicle
Yes.
with a driver who literally, I was wide awake, but the driver hadn't had enough sleep and was shifting from one lane to the next. I became so frightened. And the person was totally unaware that he was doing that. So then if somebody becomes aware whilst they're driving that they're starting to fall asleep, what is your suggestion to that driver?
Same thing as if you're drinking, a designated driver. Somebody else
But if
who
you're
is
on your
not.
own, if you've just come
If
off
you're
a
on your
shift,
own, then you've really got to. I mean, Trinidad is not the safest of countries. You
I know.
really need to pull off the highway and take a snooze. And it's amazing. If you get a 15-minute snooze, you'll wake up and you'll be able to go again for
so
a
that's
while.
the power nap, what we call power
That's the
nap.
power nap.
Okay,
Yes.
that's so interesting. Now, Dr. Medford, you mentioned about ghrelin. Is it ghrelin? Ghrelin.
Yes.
Am I pronouncing it correctly?
That's correct,
Ghrelin
yes.
is a chemical that is released when
It's released in excessive amounts. So that what happens is that that is the chemical that gives you the drive to eat rubbish. Let me give you an example of a study that was done. We took healthy university students.
This is in the US?
In the US.
Okay.
Healthy university students. You divided them into two groups. One group got lots of sleep. The other group, they were waking up throughout the night. So they did not sleep properly. They did not have sleep apnea. They just weren't allowed to sleep properly. We sent them into the same dining hall, but a lot of food choices. Those who did not get enough sleep for 2 weeks put on weight. They made the wrong choices in food. Those who got enough sleep faced with the same choices. We're talking about matched controls, age and sex and everything else. Those who got enough sleep did not put on any weight. Those who did not get enough sleep put on weight. They lost it afterwards, but during that 14-day period, they put on weight.
My goodness, those are staggering
Yes.
results. And so, Dr. Medford, I know a lot of people are very interested in this information. How can someone get in touch with you? Where can they find you? Where can they find your sleep center? And set up an
I am at
appointment?
Gulfview Medical, so they can call Gulfview Medical and get in contact with me there.
Okay, so they can find the phone number in the phone book or call direct
Yes.
assistance to find out. And so someone want to call in and just say that I'd like to make an appointment with you to have a sleep study done.
Yes.
Okay. And it's done by you personally, or you have a technician?
We have
on
a
staff?
technician.
Okay.
Yes.
So then the person would make the appointment to go in by what time?
What has to happen, I prefer to see the patient so that I get a good examination of the upper area and see what the problem is.
So you meet with the person before?
I meet with the person before.
Okay.
If somebody only wants to get a sleep study, we can do that. But really, you're missing things out if you don't get the full picture. Because when I do the report, I need to know, look, am I going to recommend for this patient surgery? Am I going to recommend a CPAP? Am I going to recommend a mandibular advancing device or some other devices that are now becoming available? Am I going to recommend that for the patient? Because at the end of the day, CPAP is not the answer for everybody. It is the best answer. But the lady who snores when she's out with her friends can't wear a CPAP. she can wear a mandibular device.
Right.
And that's it.
So in closing, because we're getting ready to wrap
Close
the
to the end.
program, I need to have you share your closing thoughts with us.
The most important thing to look at is it possible that you may have sleep apnea? And why should you check for sleep apnea? Because it affects your life, the quality of life and the length of your life. And the things to look at are the 4 things. Do you snore loudly so somebody in the room next door can hear you? Do you feel sleepy during the day? Do you gasp for breath? Has anybody observed that you stop breathing for a short period of time? Do you have hypertension? And the other things to look at is if you're male and if you're overweight. Those are 2 extra nails in the coffin to say, yes, you've got a high chance of having obstructive sleep apnea. And because the sequelae are so serious, just as we now will treat our diabetes, we won't ignore it. And we'll treat our hypertension, we will not ignore it. Similarly, we need to treat our sleep apnea. And we have to think of sleep apnea the same way we think of diabetes.
Well, Dr. Medford, it was a pleasure having you with us today on the Wellness and You show. Of course, you know, we're going to want to have you come on again because I know a number of people call in who were not able, and others who were not able to get through, and we apologize for that. However, we will have Dr. Medford on again at a time that he is available to us. And this is the Wellness and You show. I'm Karen Rudd. Thank you so much for tuning in. Remember, we're on every Tuesday afternoon, just after the 3 o'clock news until 4. This is the Wellness and You show. I'm Karen Rudd. Dr. Medford, thank you so much for your time.
Thank you for having me.
Everybody, ciao for now, and we'll see you again next week. Same time, same station.